You are listening to the Pregnancy Podcast with Vanessa Merton. Hello, thank you for tuning into the Pregnancy Podcast. Today's episode is on navigating morning sickness during pregnancy. Morning sickness is one of the most common symptoms when you're pregnant, and it affects up to 80% of expecting mothers. Despite the name, it can occur at any time of day, and it can range from mild nausea to severe vomiting. In today's episode, I will provide a thorough deep dive into morning sickness. We'll explore the science behind its causes, including groundbreaking new research on the hormone GDF15. We will review a full range of evidence-based remedies, things from dietary changes and supplements to acupressure and prescription medications. Plus, we will discuss hyperemesis gravidarum, how morning sickness can impact your quality of life, what the research suggests about a possible protective effect of morning sickness, and how your partners can assist you. Whether you're struggling with nausea, you're seeking relief, or you simply want to understand why this happens, this episode has you covered. You can find the full article and all of the resources for this episode at pregnancypodcast.com/morning sickness. You are currently listening to the public feed of the podcast. That means you have access to the last year of episodes and you will hear ads. Become a Pregnancy Podcast Premium member to get every episode ad-free, including hundreds of episodes with research-backed information that you won't find anywhere else. Check out Pregnancy Podcast Premium at pregnancypodcast.com/premium. Zoller goes above and beyond to formulate their prenatal plus DHA. It's made with high-quality ingredients like the active form of folate, bioavailable iron, and essential nutrients like omega-3s. In March 2026, save 30% on the Zoller Prenatal Plus DHA vitamin on Amazon with the code PREPODHA30. Plus, if you email your order number and mailing address to vanessa@pregnancypodcast.com, Zoller will send you a free silicone baby bib. You can always check for the current promo code at pregnancypodcast.com/vitamin. As the #1 baby monitor brand in North America, VTech is trusted by millions of families to deliver crystal clear HD video, reliable performance, strong night vision, and convenient smartphone access. The VTech Smart HD Plus is designed for flexibility and peace of mind, both at home and on the go. Check out the VTech Smart HD Plus at pregnancypodcast.com/HD plus and save 20% with the code VTPodcast20. From skincare to treating common pregnancy symptoms like stretch marks with clinically proven ingredients, 8 Sheep Organics makes amazing 100% clean, natural pregnancy products. Every product from 8 Sheep comes with a 100-day happiness guarantee. You can try it completely risk-free, and if you are not 100% happy with your purchase, simply send them an email and they'll get you a refund, no questions asked. Check out 8 Sheep Organics and save 10% when you go to pregnancypodcast.com/8sheep. Morning sickness is the common term for nausea and vomiting of pregnancy. This affects 70 to 80% of expecting moms. Despite the name, it doesn't just happen in the morning. It can occur at any time of day or night. For some women, it lasts all day. The medical term that you see when you're researching this topic is nausea and vomiting of pregnancy, or NVP. Morning sickness is most common in the first trimester. This can start as early as 1 to 2 weeks after conception. If you do experience morning sickness, symptoms typically begin before 9 weeks. For most women, it resolves by about week 14, around the start of the second trimester. But for some expecting moms, symptoms can persist well into the second trimester and in rare cases throughout the entire pregnancy. While figures vary slightly across different studies, research shows that up to 15% of women experience nausea beyond 20 weeks. The severity of morning sickness varies a lot. Some women feel mildly nauseous for a short period each day. Others have persistent nausea, frequent vomiting, and difficulty eating or drinking. We will talk more about this, and understanding where you fall on this spectrum can help you and your doctor or midwife decide on the best approach to manage your symptoms. We like to blame hormones for nearly everything that happens during pregnancy. For decades, researchers suspected that hormones play a role in morning sickness, but the exact mechanism was not well understood. That changed significantly with a landmark study that was published in Nature in 2023. That identified a hormone called growth differentiation factor 15, abbreviated GDF15, as a major driver of nausea and vomiting during pregnancy. GDF15 is a hormone that acts on the brainstem to cause nausea and vomiting. During pregnancy, the placenta produces this at high levels. And research shows that the vast majority of GDF15 in a pregnant woman's blood comes from the fetal-placental unit, meaning that the baby and the placenta are the primary source. Higher levels of GDF15 in maternal blood are associated with more severe nausea and vomiting. But here's where things get interesting. The severity of morning sickness depends not just on how much GDF15 is produced during pregnancy, but also how much exposure a woman had to GDF15 before pregnancy. Women who have naturally lower levels before becoming pregnant appear to be more sensitive to that dramatic rise that occurs in early pregnancy. This means that the sudden increase from a low baseline to a high level during pregnancy might be what's triggering the nausea. There's actually a blood condition called beta thalassemia that causes chronically high GDF15 levels. And women that have this condition, because they're already accustomed to elevated GDF15 levels, the increase in pregnancy is less of a shock, and they report very low levels of morning sickness. This research was very significant because it opens the door to potential future treatments. In this study, mice that were pre-treated with GDF15 became desensitized to it and showed fewer signs of nausea when exposed to higher levels. Researchers are now exploring whether building up a woman's tolerance to GDF15 before pregnancy could help prevent morning sickness. There are several drugs that block the GDF15 pathway that are currently in clinical trials for cancer patients with nausea and vomiting. Researchers hope that these may eventually be tested for use during pregnancy. In addition to GDF15, there are other hormones that likely contribute. One is HCG. This is human chorionic gonadotropin. This is the hormone that gives you a positive pregnancy test. Morning sickness tends to peak around the same time that HCG levels are the highest. That's around 12 weeks. Plus, you have higher levels of estrogen, progesterone, prostaglandin E2. Those have also been linked to nausea during pregnancy. Plus, you have a heightened sense of smell, which is very common in the first trimester and can also trigger or worsen nausea. Before you get pregnant, there's no way to actually predict whether you will experience morning sickness, but there are some factors that make it more likely. Genetics play a significant role. If your mother experienced morning sickness, you are more likely to it as well. If you had morning sickness in a previous pregnancy, you have a higher chance of experiencing it again. Women who are prone to motion sickness or migraines are also at an increased risk. If you have a history of nausea when taking birth control pills, those tend to be high in estrogen. You may be more susceptible. And expecting twins or multiples also increases the likelihood. That's because HCG levels tend to be higher in multiple pregnancies. Also, because the placenta produces GDF15, it's plausible that multiple pregnancies could also result in higher levels, although that hasn't been specifically studied. The effects of morning sickness extend well beyond just the physical discomfort. There is a mental and emotional component to morning sickness that is often not discussed. Having morning sickness can significantly affect your quality of life, especially in the first trimester when many women have not yet shared their pregnancy news, so they can't explain to anyone why they're not feeling well. They may be missing work, canceling plans, or just struggling with everyday activities. Research shows that morning sickness can significantly impact family life, the ability to perform usual daily activities, social functioning, stress levels, and even the intention to have more children. One thing worth noting as a potential strategy to counteract the emotional side of morning sickness is exercise. And research shows that exercise is associated with a higher quality of life and better mental health. Another thing that's not talked about enough is that there's this unspoken expectation that you should feel nothing but gratitude for being pregnant. And I get it, the opportunity to carry a baby is definitely something to appreciate. But that does not negate the real physical and emotional challenges of pregnancy. Feeling miserable doesn't make you any less grateful, and nor should it diminish the value of your experience. It is completely valid to acknowledge that pregnancy is hard. And whether it's due to morning sickness or something else, you may have moments where you don't enjoy being pregnant. Not only is that okay, but it's normal. It's also worth remembering that what we see from expecting moms online, what you're seeing on Instagram, this is the polished version of pregnancy. All the weekly countdowns, the cute outfits, the nursery photos. Most women are not posting about how terrible they feel or how much they're struggling with morning sickness. If you are struggling with this symptom, I want you to know that you're not alone, and it's important to acknowledge the mental and emotional impact of this. Many studies have explored whether morning sickness serves a protective purpose. One hypothesis is that nausea and aversion to certain foods may protect you and your baby from potentially harmful substances during a very critical period of development. And that makes sense. Nausea in early pregnancy can also alert you to the fact that you're pregnant, sometimes even before a test would give you a positive result. Because nausea and vomiting are linked to hormone production, experiencing these symptoms could also be a sign that your body and your placenta are producing the hormones that are needed for a healthy pregnancy. There is a widely cited study that made headlines when it found that morning sickness was associated with a reduced risk of miscarriage, essentially that there is a protective effect to it. However, there is nuance to this. This specific study was enrolling women who had already experienced 1 to 2 prior pregnancy losses, so it was likely a higher risk group to begin with. For this group, nausea and vomiting were common very early in pregnancy and were associated with a lower risk of pregnancy loss. So according to this research, morning sickness is a positive sign of a healthy pregnancy. The flip side of these findings is that it can create unnecessary anxiety. If you are not experiencing morning sickness, it does not mean that something is wrong. There was a study that looked at morning sickness and rates of major malformations, and they did not find an association between the absence of morning sickness and an increase in the overall rates of malformations. This conversation is still evolving, and there's still a lot that we do not know. If you're dealing with morning sickness and it helps you to think that nausea may be a positive sign for your pregnancy, that's great. But do not stress if you are symptom-free. There are plenty of healthy pregnancies that occur without any morning sickness. On the severe end of the spectrum is hyperemesis gravidarum. This is often abbreviated as HG. This is more than just severe morning sickness. It's a serious medical condition characterized by persistent nausea and vomiting that leads to significant weight loss, typically more than 5% of your pre-pregnancy weight, along with dehydration and metabolic disturbances. This affects approximately 0.3 to 3% of pregnancies, and it is the leading cause of hospitalization in the first half of pregnancy. The symptoms of hyperemesis gravidarum typically begin between 4 and 6 weeks, and they can persist well beyond the first trimester. In some cases, symptoms continue throughout the entire pregnancy. Common clinical signs include dehydration, high levels of ketones, electrolyte imbalances, or a sudden drop in blood pressure. And if left untreated, it can cause complications. The GDF-15 research that we talked about has provided major insight into why some women develop HG. Women with HG tend to have significantly higher circulating levels of GDF-15 during pregnancy. So those with a genetic predisposition to lower GDF-15 levels before they get pregnant appear to be hypersensitive to that rapid increase that happens when the placenta begins producing it. If you are experiencing severe nausea and vomiting, if you are unable to keep food or fluids down, if you're losing weight, you feel dizzy or faint, please get in touch with your doctor or midwife. Don't wait until your next scheduled prenatal appointment. Call them and get in to see them sooner. HG can require medical intervention, and there are treatments like IV fluids, electrolyte replacement, and medications. Early treatment is important, and that's because morning sickness can escalate if it's left untreated. So when you're not treating it, it can lead to not eating, which drops your blood sugar, which makes the nausea worse. That cycle can lead to dehydration, which can make everything harder to manage and can eventually result in hospitalization. The American College of Obstetricians and Gynecologists emphasizes that treating symptoms early, even with simple dietary changes or vitamin B6, we will talk all about that in a few minutes, can help prevent that cycle from taking hold. If you wait until symptoms are severe, they can be much harder to bring under control. The takeaway here is that you don't just have to tough it out. Address symptoms early, even if they're mild, and that will give you the best chance of keeping them manageable. Now that we have covered the science behind why morning sickness happens, let's talk about practical strategies to help you find relief. Keep in mind, everyone is different, and what works for one expecting mother may not work for you. Finding the right approach is probably going to involve some trial and error. One helpful strategy as you're going through these things is to keep a journal and track your symptoms, track what you eat, and keep notes on what seems to help or worsen your nausea. Over time, this can help you identify patterns that can make it easier to manage. Let's start with dietary strategies. What and how you eat can make a real difference in how you can manage morning sickness. One of the most important strategies is eating small, frequent meals throughout the day. An empty stomach can make nausea significantly worse, so you want to avoid long gaps between meals. Instead of 3 large meals, try eating 5 or 6 smaller meals or snacks spaced throughout the day. You may want to eat something first thing in the morning, even before you get out of bed. And that's because your blood sugar levels drop during the night. Waking up with low blood sugar can contribute to nausea. Keeping crackers or a small dry snack within reach so that you can eat a few bites before you even get up and get out of bed is actually a widely recommended strategy. This is one of the most commonly cited tips in clinical guidelines, including those from ACOG. Another thing that may help is including protein in every meal or snack. Protein is digested more slowly than carbohydrates, and that can help stabilize blood sugar and may reduce the likelihood of feeling weak, lightheaded, or hungry, all of which can trigger nausea. Good protein-rich options include things like nuts, cheese, yogurt, eggs, and nut butters. Even adding a small amount of protein to a carb-heavy snack, like pairing crackers with cheese or toast with nut butter, may be helpful. When it comes to what to eat, easy to digest foods are usually the best tolerated. ACOG suggests the BRAT diet. This is a good starting point. BRAT stands for bananas, rice, applesauce, toast, and tea. And toast. These foods are low in fat, they're bland, and they're pretty gentle on the stomach. Another thing to consider is that cold or room temperature foods may be easier to manage than hot foods. That's because strong food odors can be a major trigger for nausea, especially with a heightened sense of smell. If cooking smells are a problem, you can consider asking your partner or someone else to handle food prep. You may want to temporarily switch to meals that require minimal cooking, or make sure you're opening windows or using a fan when food is being prepared. One thing that is very crucial is staying hydrated, especially if you are vomiting. Dehydration can make nausea worse, and it can lead to additional complications. If drinking water is difficult, there are some alternatives worth trying. Sparkling water may be helpful. The carbonation may help settle your stomach. Sucking on ice chips, frozen fruit popsicles, or just slowly sipping cold liquids can make hydration a little bit more manageable. Some women find that drinking through a straw helps them consume more fluids. The key is to drink in small amounts throughout the day rather than trying to drink a large volume all at once. Next, let's talk about supplements. If your prenatal vitamin is making your nausea worse, try taking it with a meal or a snack, or switch to taking it at night right before bed. Interestingly, research shows that taking a prenatal vitamin before getting pregnant may actually reduce the severity of morning sickness, and that could be due to vitamin B6. There is evidence that vitamin B6 may reduce nausea in pregnant women. ACOG recommends B6 as a safe, over-the-counter first-line treatment for nausea and vomiting of pregnancy. Of course, you always want to consult with your doctor or midwife before starting any new supplement, including B6. They can help you navigate that and advise the right dosage and factor any specifics of your pregnancy. Another common remedy is ginger. A systematic review and meta-analysis found that ginger significantly reduced nausea symptoms compared to placebo. You can consume ginger in a lot of different forms. There's ginger tea, ginger candies, supplements, or even maybe ginger ale. If you drink ginger ale hoping to get the anti-nausea benefits of ginger, you should know that most commercial ginger ale brands contain very little actual ginger. Most brands like Canada Dry and Schweppes list less than 2% ginger extract in their ingredients. Actually, the parent brand of both of these companies paid over $11 million in legal settlements for misleading marketing about their ginger content. In addition to containing very small amounts of actual ginger, most commercial ginger ale is also very high in sugar or high fructose corn syrup. Ginger beer typically contains more real ginger than ginger ale. That's what gives it a stronger, spicier flavor. But this can also be high in sugar, so something to keep an eye on. If you want the actual therapeutic benefit of ginger, your best options are either a ginger tea that's brewed from fresh ginger root, ginger supplements, or ginger candies. But if you're getting candies, make sure that they list real ginger as the primary ingredient. These are more likely to provide the active compounds that the research has shown to be effective. Before we get into more remedies and the evidence to either back them up or debunk them, I want to thank the sponsors that have supported this episode. A lot of companies have exclusive discounts for pregnancy podcast listeners. You can always see discounts and promo codes at pregnancypodcast.com/resources. It's challenging to meet your increased nutrient needs during pregnancy through your diet alone. Taking a high-quality prenatal vitamin is the easiest way to ensure that you and your baby are getting all of the vitamins and nutrients you need. My top recommendation is the Zoller Prenatal Plus DHA. With any vitamin or supplement, my top priority is always high-quality bioavailable ingredients, which is why I love Zoller. Plus, they formulate their vitamin on the latest scientific evidence, not outdated RDAs that can lag years behind the research. Each serving includes 300 milligrams of DHA. This is a critical nutrient for your baby's brain and eye development. DHA can also support mood, cognitive function, and can be important for your mood postpartum. The majority of prenatal vitamins contain 0 DHA. This is just one detail on a long list as to why this is my favorite prenatal vitamin. In March 2026, save 30% off the Zoller Prenatal Plus DHA on Amazon with the code PREPODHA30. Plus, if you email your order number and mailing address to vanessa@pregnancypodcast.com, Zoller will send you a free silicone baby bib. You can always check for the current promo code for the Zoller Prenatal at pregnancypodcast.com/vitamin. You can get a 20% discount on select products from VTech with the code VTPodcast20. VTech offers a wide range of baby monitors, and they are the #1 baby monitor brand in North America. The VTech Smart HD Plus is designed for families that want flexibility and peace of mind, both at home and on the go. There's a 1080 pixel HD camera with a 135-degree wide-angle lens, a 5.5-inch parent unit with high color accuracy, free access to the My VTech Baby Plus mobile app with no subscription required. You can remotely pan, tilt, and zoom. There's a multicolored nightlight with adjustable brightness, two-way talk, soothing sounds and lullabies, motion and temperature sensors and alerts, infrared night vision, and a private encrypted video connection. The Smart HD Plus offers high-definition video on a 5.5-inch parent unit and a smartphone with no monthly fees. As the #1 baby monitor brand in North America, VTech is trusted by millions of families. Check out the VTech Smart HD Plus at pregnancypodcast.com/HD Plus and save 20% with the code VTPodcast20. Let's get back to today's episode. One of the most widely used natural remedies for pregnancy nausea that is supported by evidence is lemons. One study found that 40% of women used lemon scent to relieve nausea and vomiting during pregnancy, and about 27% reported that it was effective. The exact mechanism behind why lemon helps with nausea isn't fully understood, but there are some theories. One is that the strong, clean citrus scent may help override other unpleasant odors that can trigger nausea, effectively distracting your brain from nausea signals. Citric acid, which is one of the main compounds in lemon, may have a calming effect on the stomach by stimulating areas of the brainstem that are involved with regulating nausea and vomiting. For many women with a heightened sense of smell during pregnancy, that sharp, fresh aroma of lemon appears to cut through environmental smells that can make nausea worse. If you want to try lemons, you can try smelling a fresh lemon. You can squeeze a wedge into a glass of water. You can inhale lemon essential oil, or just try incorporating lemon into foods and drinks. Lemons are inexpensive, easy to get, and there's no downside here, so it's an easy remedy to try. On the topic of scents that may be helpful, let's talk about essential oils and aromatherapy. The essential oils that are most commonly recommended for morning sickness are lavender, ginger, peppermint, spearmint, and citrus oils like lemon, grapefruit, lime, and orange. One study examined the effects of inhaling lemon essential oil when participants first felt nauseous. Researchers found a greater decrease in morning sickness with lemon oil inhalation than with a placebo. Another study that combined lemon and peppermint essential oils found that nausea and vomiting intensity decreased significantly in the treatment group compared to the placebo. In both of these studies, the differences between the treatment and control groups were not significant on the first day, but they did become significant on subsequent days. This suggests that essential oils may be more effective with consistent repeated use rather than just one single application. If you're looking for more evidence on using essential oils during pregnancy or potentially during your labor, there is a full episode that examines the safety and all of the evidence on essential oils, and I will link to that. Another thing you may want to try is simple changes in your environment and position. Stuffiness indoors can worsen symptoms, so opening a window or stepping outside for fresh air may be helpful. Gentle movement, like a short walk, may help you feel better. After eating, you should avoid lying down. That can slow digestion and contribute to acid reflux, which can make nausea worse. So after you eat, it's best to sit upright or slightly reclined rather than laying down. Another thing you may be interested to try is acupressure or acupuncture. These are both traditional practices that involve stimulating specific points on the body to relieve symptoms. Acupressure uses physical pressure, typically from your fingers or a wearable device, while acupuncture uses thin needles that are inserted by a trained practitioner. Both have been studied as treatments for nausea during pregnancy. The most commonly studied point for nausea relief is called P6. This is located on the inside of your wrist, about 3 finger widths below the base of your palm, between the two tendons. You may have seen that there are wristbands marketed as C-bands or anti-nausea bands. Many people utilize these for motion sickness. They work by applying constant, gentle pressure to the P6 point. These are widely available at pharmacies and drugstores. They're inexpensive, and they have no known side effects. One study found a statistically significant effect of acupressure at that P6 point in reducing the degree of nausea and vomiting in women that had hyperemesis gravidarum. Because these wristbands are low risk, they're easy to use, it may be worth a shot, even if they're only providing modest relief. If you'd like to go a step further, acupuncture takes a different approach. Rather than applying pressure, a trained acupuncturist inserts very thin needles at specific points on the body to stimulate those areas. There is some evidence that acupuncture can improve symptoms of nausea and vomiting during pregnancy. The main considerations with acupuncture are the time and cost of seeing a professional. This is not something that you can do to yourself at home. However, if other remedies are not giving you enough relief, this may be an option. If lifestyle changes, over-the-counter remedies are not providing enough relief, there are prescription options available. A lot of pregnant moms don't seek treatment for morning sickness because they either just assume that it's something they have to deal with, or they have concerns about medication safety during pregnancy. You need to know that there are well-studied options that exist. And if you'll recall, we also talked about how when morning sickness is untreated and it progresses, it can become harder to manage. So if you do not address nausea, that can start a cycle where not eating drops your blood sugar, which makes nausea worse, which can lead to dehydration, which makes everything harder to bring under control. Addressing symptoms early will give you the best chance at keeping them manageable and can prevent more serious complications. ACOG provides a stepwise treatment algorithm for morning sickness. The first step is dietary and lifestyle changes. If those are not sufficient, then vitamin B6 is recommended as the first line of treatment. If B6 alone is not enough, then doxylamine, which is an antihistamine found in some over-the-counter sleep aids, can be added. Before we really dig into these medications, understanding how these work may help you feel more confident about discussing them with your doctor or midwife. B6 is involved in the production of neurotransmitters, including serotonin and dopamine, and those play a role in how your brain processes nausea. While the exact mechanism isn't fully understood, supplementing with B6 appears to help regulate these signals and reduce nausea for many women. Doxylamine is an antihistamine that works by blocking histamine receptors. By blocking those receptors, doxylamine helps reduce the nausea signal. This is the same reason as to why antihistamines are used for motion sickness. A common side effect of doxylamine is drowsiness, which is why it is also the active ingredient in certain over-the-counter sleep aids. When B6 and doxylamine are used together, they act through two distinct pathways to reduce nausea. That's why the combination is often more effective than either alone. The combination of doxylamine and B6 has been used to treat morning sickness since the 1950s. A prescription medication called Diclegis combines doxylamine and B6 in a delayed-release tablet. This is currently the only FDA-approved medication specifically indicated for nausea and vomiting of pregnancy. Diclegis is the most extensive studied medication for morning sickness, and it has safety data from more than 200,000 pregnancies. The most common side effect is drowsiness, which again makes sense because of how doxylamine works. It's worth noting that both doxylamine and B6 are available individually over the counter. However, the prescription delayed release formula is specifically designed to provide sustained relief throughout the day and night. The individual over-the-counter versions, of course, don't offer this. If you and your care provider decide to go the over-the-counter route, ensure that you purchase the correct product. You need to be careful because doxylamine is the active ingredient in Unisom sleep tabs specifically. There are other Unisom products that contain a different antihistamine called diphenhydramine, and that is not the same medication. Of course, you always need to run any medication by your doctor or midwife. If the combination of doxylamine and B6 does not provide adequate relief, your care provider can discuss additional options. Ondansetron, which you may know by the brand name Zofran, is an anti-nausea medication that was originally developed to treat nausea and vomiting caused by chemotherapy. It works by blocking serotonin receptors in the brain and gut. Serotonin is one of the key chemical signals involved in triggering nausea and vomiting reflex. By blocking these receptors, it can significantly reduce symptoms. You should note this is not FDA approved for use in pregnancy specifically, but it is commonly prescribed off-label for cases of morning sickness that do not respond to B6 and doxylamine. If your care provider recommends ondansetron, they can discuss the evidence and help you weigh the benefits and risks for your situation. The key takeaway is that safe treatments do exist, and you do not have to suffer through morning sickness without help. Please talk to your doctor or midwife if you are struggling. Starting treatment early, even with something as simple as vitamin B6, can help prevent symptoms from escalating. One often overlooked consequence of morning sickness is its effect on your teeth. If you are vomiting frequently, your tooth enamel is being repeatedly exposed to stomach acid, and over time, this can erode the enamel and increase your risk of cavities. There is a tip I have for you that might seem a little counterintuitive. Don't brush your teeth immediately after vomiting. Brushing while you have stomach acid still on your enamel can actually scratch and further damage it. Instead, rinse your mouth with a mixture of about 1 teaspoon of baking soda and a cup of water. The baking soda will help neutralize the acid, and then wait a few minutes before you brush your teeth. That small adjustment can make a big difference in protecting your teeth during pregnancy. Another topic we have to cover on this subject is cannabis. This is becoming more widely legal and accessible, and it makes sense to wonder whether it could help with morning sickness. Cannabis has long been used to treat nausea in other medical contexts, like with chemotherapy, which makes it a natural question. So let's look at what the research and the current medical guidelines say. In 2025, the American College of Obstetricians and Gynecologists published a comprehensive clinical consensus on cannabis use during pregnancy and during lactation. ACOG's recommendation is very clear that there is no medical indication for cannabis use during pregnancy. They advise that clinicians should counsel patients to discontinue cannabis use during pregnancy and lactation and work with them to find alternative methods to address health concerns. And this goes for consuming cannabis in any form. The research behind this recommendation shows that cannabis use during pregnancy has been associated with adverse outcomes, including spontaneous preterm birth, low birth weight, NICU admissions, and postnatal neurocognitive and behavioral effects in children. To understand why, it helps to know a little bit about how cannabis interacts with the body. Cannabinoid receptors are proteins that are found throughout the body, including in the brain, gut, and reproductive tissues. These receptors respond to compounds that are found in cannabis, known as cannabinoids. The most well-known of these is THC. When THC enters your body, it binds to these receptors and produces its effects, including things like changes in mood, appetite, and nausea. The reason that this matters during pregnancy is that THC crosses the placenta, meaning that it reaches your baby. And the fetus begins developing cannabinoid receptors very early as 5 weeks, which is before most women even know that they're pregnant. This means that if you are consuming THC, that can reach your baby and interact with those developing receptors during a very critical period of brain and organ development. THC is also transferred through breast milk, which is why ACOG recommends against using cannabis when you are breastfeeding. It's important to know that medical marijuana is not safer than recreational cannabis. Both of these contain the same active compounds. And if you're wondering about CBD products, those are also not recommended during pregnancy. These are not regulated by the FDA, and many products have been found to contain THC and other contaminants. If you are using cannabis to manage nausea, anxiety, pain, or any other symptoms, please talk to your doctor or midwife. This is a topic I will likely explore in more detail in a future episode. But the brief synopsis is that the current evidence supports avoiding cannabis during pregnancy. As you are navigating your pregnancy, your partner can play a significant role in helping you navigate morning sickness. Even small gestures can make a big difference when you're dealing with constant nausea, and letting your partner know what you need is a really good place to start. One of the most practical things that your partner can do is to take over cooking and food prep, especially if food smells are triggering your nausea. Opening windows, running a fan while they're cooking, or preparing cold meals that just have less odor in general can all be helpful. Your partner can also help by keeping your kitchen stocked with snacks that you can tolerate, things like crackers, ginger tea, or whatever you find works for you. That way, you always have something available. Also, keeping water, sparkling water, ice chips readily available is another simple way your partner can support you. Beyond the practical side, emotional support matters too. It can be really helpful when your partner acknowledges that what you're going through is difficult, rather than minimizing it by saying that it will pass and it's normal. While those things may be true, they can feel very dismissive when you are really in the trenches. What tends to help more is when your partner asks what you need or takes on extra responsibilities around the house without being asked, and when they're patient with you on days when you're struggling. If you're having a really hard time with morning sickness, your partner can also encourage you to talk to your care provider or offer to go with you to your prenatal appointment. I am a huge advocate for partners attending every prenatal appointment. This is a really great way for both of you to stay informed and for your partner to be involved and hear directly from your doctor or midwife. Most morning sickness is normal, and it's a temporary part of pregnancy that does not require medical intervention beyond perhaps some lifestyle changes. But there are situations where you should contact your doctor or midwife. Red flags for that include being unable to keep fluids down for 24 hours, if you are losing weight, if you have dark colored urine, if you feel dizzy or faint, or you have a rapid heartbeat. These can be signs of dehydration or hyperemesis gravidarum. Those should not be ignored. You should also talk to your care provider if nausea is making it difficult to eat enough to meet your daily nutritional needs. If you are craving non-food items, that's another thing you should bring up with your care provider. That can indicate an underlying nutrient deficiency. It could be a condition called pica. While that is not super common, it's definitely something you should bring up with your doctor or midwife. In the vast majority of cases, morning sickness is temporary, but your provider is there to help you navigate this. So do not hesitate to reach out to them. And if you're having a hard time, do not wait until your next prenatal appointment. Contact them sooner. Even if your morning sickness feels manageable, it's still worth discussing with your care provider. They may have suggestions that you have not considered, and it's always helpful for them to know what you are experiencing. Keeping them informed about your symptoms is part of good prenatal care. To recap today's episode, we covered a lot of ground. We started with what morning sickness is, when it typically starts and resolves, why the name is misleading because it can happen at any time of day. We went through the science of what causes it, including some groundbreaking research on GDF15 and the role that hormones like HCG and estrogen can play. We covered risk factors and spent some time on the emotional and quality of life impact, including letting you know that it is okay to acknowledge that pregnancy can be hard and you may not love every minute of it. I examined the protective theory and research linking morning sickness to a reduced risk of miscarriage, along with some research that the absence of symptoms doesn't mean anything is wrong. We covered hyperemesis gravidarum. From there, we went through a full range of practical strategies to find relief. So we talked about dietary changes, hydration, supplements like B6 and ginger. We talked about essential oils, movement, acupuncture, acupressure. I also covered your options for prescription medications. We touched on protecting your oral health, talked about cannabis during pregnancy to manage nausea, and covered how your partner can be helpful. And then wrapped up talking about some signs that you need to bring this up with your doctor or midwife. I'd like to thank you for tuning into the Pregnancy Podcast today. I hope that you find this episode helpful. Please share this episode if you have a friend who's pregnant. So many listeners find the podcast through recommendations, and I appreciate you sharing it. As always, you can reach me, Vanessa, at pregnancypodcast.com. You can read the full article and see all of the resources for this episode at pregnancypodcast.com/morning sickness. If you're looking for more evidence-based information, or you just want an ad-free experience, check out Pregnancy Podcast Premium. Premium members get every single episode of the podcast ad-free, including hundreds of episodes with evidence-based information exclusively available to premium members. This is content that you will not find anywhere else. Check out Pregnancy Podcast Premium at pregnancypodcast.com/premium.